Hi everyone, I'm Varuni Fernando and I am a product owner at ResMed. I studied electrical engineering and was part of the co-op program starting in 2010. I decided to do electrical engineering because I knew I wanted to do engineering. My dad was an electrical engineer and I knew I didn't want to do an engineering that involved lots of site work. I didn't want to go into civil engineering and I thought that electrical engineering would let me be on the cusp of technology. One of the key things that I wanted to do was to use my engineering skills in a healthcare field, and so electrical engineering seemed like a really great way in which to do this. I ended up in the current role that I'm in because I guess effectively got into ResMed as a graduate engineer. As part of the co-op program, I completed my internships at a couple of different places. So one of them was Downer Engineering, where I worked mostly in industrial automation of mines and aluminium smelters. Also worked at Sydney Water, also working industrial automation, but this time of wastewater treatment plants. And so this sort of experience, even though it wasn't directly related to healthcare, was a really good foundation for me when I went to apply for jobs. And I was lucky enough to get a role at ResMed. So I joined ResMed as a graduate engineer, went through their rotation program, did like manufacturing, electrical engineering and systems engineering. And that's sort of where I ended up. I ended up in systems engineering for a couple of years at ResMed Sydney. And towards the end of last year, I actually moved to Ireland on a 2-year assignment. So that's where I am now. I'm in Dublin, working as a product owner, which is effectively like a mix between a systems engineer and a product manager. And so that's what I'm doing now, working on next generation digital health technologies and interventions for patients to help them with their sleep apnea. What does my role entail? Well, my current role basically works with different stakeholders in our business, figuring out what we should be doing in the next sort of 5 to 10 years. Our team is a fairly lean team. It's cross-functional, so we have user experience designers, a behavioral scientist, we have software developers, and that's basically the sort of general skill set. We all have a bit of a biomedical background as well, so some clinical knowledge, but that this group comes together to execute on lean experiments. So we kind of come up with ideas that we think are going to work in the next sort of 5 to 10 years. And then we give them a go on a smaller sort of sample size on a prototype product and see how they go. In terms of a typical day, generally I do have about 30% of just meetings and interacting with other team members, as well as interacting with team members across the globe. So I do spend a fair bit of my time on video conferences, especially now since we're all working from home. After that, there's a fair bit of research, so sort of figuring out where the market is going, what's going on in the clinical space as well. Are there any new treatments? Is there anything sort of exciting and new in the research that we should be looking at? And then working with software developers and the rest of the team on effectively communicating what we want to do next, what makes sense, what's the priority, and why. Really being a customer advocate, so basically representing the patient in terms of our products and making sure that we're delivering the right thing. In terms of career highlights so far, I think the key ones have got to be some of the travel that I've had the chance to do. So some of it has been just work-related travel. We have worked quite closely with like the University of Barcelona on some work that we were doing, and so I got a chance to go over and work with the team there in terms of troubleshooting some of the issues that we were having. Conferences have also been quite a highlight. It's really nice to see the intersection between academia and industry coming together at conferences, and so you get to meet lots of people from around the world in one place, so that's pretty great. And I guess this assignment, because being able to move overseas and experience a new culture, a new work culture, and just learning how to live in a new country has been really, really interesting. In terms of the advice that I have for someone going into a career in electrical engineering, I think electrical engineering is this great combination of hardware and software. I found that a lot of my role now works on software solutions, but my experience in electrical engineering, particularly in like stuff like digital signal processing, since that was sort of my area of, I guess, interest, has been really good. It's this really nice intersection of having this background of hardware engineering and understanding the sort of hardware behind the tech, but also having experience in programming. It kind of lets you go in either direction or even both directions. It has been a really great foundation for me, especially as I moved on to work more on systems engineering, which is a bit more sort of higher level systems architecture work. In terms of the challenges, I have to say like the actual area itself is moving really quite quickly. And also just the coursework is quite challenging too, but I think it's a great foundation for what will be a really exciting career for you, and something that, you know, the industry is always changing, the technology is always changing, there's new stuff to learn. And so in terms of careers, opportunities and challenges, you have to be someone who's willing to keep learning, because this field does not stay still, and you've got to be willing to adapt and learn all the new technologies and how to implement them. So hopefully that gives you guys a bit of an overview about me and my career so far. And if you do wish to find out more, please feel free to reach out to me on LinkedIn. I am more than happy to answer some requests. Thank you. Bye.